എന്തെന്നെ കാണാത്ത കേക്കുന്നില്ലല്ലോ.
വീഡിയോ ആണോ എന്റെ ഇത് ബ്ലർ ആയിട്ടോ ബ്ലർ ഓഫ് ആക്കാം.
Yeah, I can hear. And how about now? Yeah, I just changed the setting up over there to same as system. Okay. So, Sri, are you here?
Yes, sir. We can hear you, sir.
Okay. So no issues with the voice, right?
Yes,
Yeah,
sir. No issues.
I can hear. And how about now?
Perfect, sir. Okay, sir. Yes, sir. I am here. Yes, sir. We can hear you, sir.
I guess, Sri, it is coming like a echo sound.
Am I audible?
Yeah, you are audible. You are audible. Shama, what you can do is there, you can change your name. It says that Ganga.
Oh, okay. How do I change it?
Just give a right click on that name and it will give you the edit option to edit your name.
Okay, rename.
Yeah, rename.
Okay. All good?
Yeah, now all good. I guess at first they will play some video for 5 minutes, 10 minutes, and then they will just post some flyers. And then meanwhile, I will ask all the other team members to join. So Neha is the one who will be hosting event. Okay, so I will ask her to join and the other team members will also join.
Oh, okay.
So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates, guys, it's an update regarding Canada PEBC exam. So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates who are planning for the first part of the PEBC examination, that is evaluating examination, so they can sit 4 times a year from 2025. For examination pattern, so they are going to make some changes. So especially like earlier it used to be like 200 MCQs, but now they are going to reduce it to 150 MCQs. However, there is no change in the passing percentage or the score. So the passing score, it still remains 60% to get in the PEBC examination. Okay. So thank you so much. Thanks for watching this video and stay tuned with Elite Expertise for more updates. Hello guys, it's an update regarding Canada PEBC exam. So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates who are planning for the first part of the PEBC examination, that is evaluating examination, so they can sit 4 times a year from 2025. For examination pattern, so they are going to make some changes. So especially like earlier it used to be like 200 MCQs, but now they are going to reduce it to 150 MCQs. However, there is no change in the passing percentage or the score. So the passing score, it still remains 60% to get in the PEBC examination. Okay. So thank you so much. Thanks for watching this video and stay tuned with Elite Expertise for more updates. Hello guys, it's an update regarding Canada PEBC exam. So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates who are planning for the first part of the PEBC examination, that is evaluating examination, so they can sit 4 times a year from 2025. For examination pattern, so they are going to make some changes. So especially like earlier, it used to be like 200 MCQs, but now they are going to reduce it to 150 MCQs. However, there is no change in the passing percentage or the score. So the passing score, it still remains 60% to get in the PEBC examination. Okay. So thank you so much. Thanks for watching this video and stay tuned with Elite Expertise for more updates. Hello guys, it's an update regarding Canada PEBC exam. So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates who are planning for the first part of the PEBC examination, that is evaluating examination, so they can sit 4 times a year from 2025. For examination pattern, so they are going to make some changes. So especially like earlier, it used to be like 200 MCQs, but now they are going to reduce it to 150 MCQs. However, there is no change in the passing percentage or the score. So the passing score, it still remains 60% to get in the PEBC examination. Okay. So thank you so much. Thanks for watching this video and stay tuned with Elite Expertise for more updates. Hello guys, it's an update regarding Canada PEBC exam. So for PEBC exam, starting from 2024 October, they are going to conduct it 3 times a year. And from 2025, that is from next year, they are going to conduct it 4 times a year. So it means that all the overseas candidates who are planning for the first part of the PEBC examination, that is evaluating examination, so they can sit 4 times a year from 20. To save up to 60% on groceries. Hi, Shama.
Hi.
New to
Hello everyone, welcome to live webinar of Elite Expertise for PEBC. We are happy we are on live today. It's a great evening for us, for everyone. Welcome Shama. Hello sir, good evening.
Yeah, hi Neha.
Myself Neha, I'm the admin manager of Elite Expertise. As we all know, Elite Expertise is an online education platform who is providing KAPS coaching since 1 year, and we are happy that we have launched PEBC coaching also. And we are excited that we are soon starting our PTS coaching as well. And I would like to introduce Shama to everyone.
Hi.
She's our she's the asset for Elite Expertise for PEBC. And that's it from my end. And I would like to give this opportunity to Arif sir.
Yeah, thank you so much, Neha. So, we are here to announce that we are going to start our PBC training from 20th of July. And like myself, I'm the director of Elite Expertise, and my name is Arif Mohammed. I'm the director of Elite Expertise. And currently, I'm working as a clinical pharmacist in Northern Health Hospital in in Northern Health Hospital in Melbourne. And we are going to start this new program, that is the PBC training, for those who are planning to sit for the Canadian PBC examination. And in this training, we have approached a lot of Canadian pharmacists. We took their opinions and also from their inputs and so on. So one of the Canadian pharmacists we have here today is Shama. Shama is with us. So we also I have also consulted a lot of other Canadian pharmacists who are practicing here in Melbourne at the moment. So they are they are registered pharmacists in Canada, but right now they moved to Australia and they are practicing as a clinical pharmacist in Monash as well as in Royal Melbourne Hospital. So I have contacted them, and I took a lot of information from them. And finally, we have designed this program, that is the PEBC training, that at first we are going to start the evaluating exam preparation course. Okay. And today, I'm glad to introduce Shama. So Shama is with us today. So Shama is a Canadian pharmacist. She's a fully licensed pharmacist. And Shama has cleared all the Canadian pharmacist licensing examination, that is evaluating as well as qualifying, both the qualifying exams in her first attempt. And she's a fully licensed pharmacist. And Shama is with us, she's one of the team members in designing and as well as in taking the lectures for the PBC program. So,
Hi, everybody. Good to see you all. Okay, a little bit about me. I work as a practicing pharmacist in Canada. I work as a relief pharmacist. So those who don't know what a relief position is, we should be going to different stores where they are in need of help. So I work with community pharmacy, long-term care pharmacies, and I work as a registered pharmacist, and I act as a consultant pharmacist too. I started my career in Canada in the year 2022. I joined Elite Expertise in 2024. So now we are kind of designing our courses and stuff for evaluating exams. So that is the first step in PEBC licensing process. So excited to see you all and answer all your queries today.
Yes, thank you so much, Shama. And today we got a lot of queries, and Neha has been she has been sorting a lot of queries from the last 1 week, and she has got a lot of questions to ask us, and she just want to these are the questions the candidates they have been asking her through different social media platforms.
Yes.
So I would like to ask Neha to start. In case if you have any questions, then you can just start. And myself and Shama will be there, so we both will be ready to give the answers.
Sure.
Thank you, sir. Actually, since we are starting this preparation course, PBC for the first time,
Yeah.
Students have many doubts. Like we have got n number of doubts from students as well. Like I would like to put them in front of you so that everyone will be having like clarity on them, and that's it. We can clarify here, and since it is a live webinar, many candidates will get clarified here itself. And the first thing is, what is this kind of like what is this PEBC and why is it essential to work as a pharmacist in Canada, sir?
So, well, we all know that PEBC is the licensing examination for Canadian pharmacists. So for all the overseas pharmacists, those who have studied in either India or in any other countries other than Canada, okay, so they all need to go through the pathway, that is the PEBC pathway. Okay? So they need to write the PEBC exam, and then they need to get the PEBC exam certificate. Then only they can get registered as a pharmacist in Canada. So similar to that of how we do in case of Australia. So at first we need to clear the KAPS exam, and during the internship there will be 2 more exams. Then once we clear all those exams, then we'll get fully licensed pharmacist in Australia. In a similar way in Canada as well. So there will be the pathway. That pathway is known as the PEBC pathway, through which all the exams, the candidates, they need to clear the exams. So there will be 3 exams. The first one is the screening exam, that is known as the evaluating exam. And after clearing the evaluating exam, then they need to clear the qualifying exam. So qualifying exam is like there are 2 parts in qualifying exam. So the first part is the MCQ based exam, and the second part is the OSCE based. And Shama, would you like to add a few more points for it?
Yeah. So PEBC is like a national body that makes sure that our credentials and knowledge and experience match Canadian pharmacists. So they are like the national body. They will evaluate everything, and they will make sure we are equivalent to a Canadian graduate. So the PEBC has launched three steps. Like you have to first get your credentials cleared. Like you have to make sure your undergraduate pharmacy program is equivalent to a Canadian pharmacy graduate program here. That will be the very first step. Then you have to go through the evaluating exam, as Dr. Arif was discussing. So that will be like a preliminary exam where you get assessed all the basic essential that you learn in your undergraduate program. So they basically test your biomedical science and pharmacy practice skills and administration. Those are the major syllabus that is under PEBC evaluating exam. So once you have to score around 60% to clear pharmacy evaluating exam. Then you can appear for qualifying exam, that is MCQ. That is like a computer-based exam, like a 1-day exam. Again, you have to pass that exam. Then you will go to OSCE. That is different from evaluating an MCQ, where it's like a practical examination. There will be like case scenarios. There will be simulated case stations where you will have, they will mimic the real case scenarios. So you will be assessed based on each cases, how you resolve it, like how you resolve it as a pharmacist, how you approach to a patient. So once you clear all 3 examination, then you can go with different province and follow their regulation to get licensed as a pharmacist. But the very first step is getting licensed, like getting all the exams cleared through PEBC.
Thank you, Shama, for clearly explaining what Canada is expecting for a pharmacist, for PEBC exam. And
Yes.
sir, is there anything to add?
No, not at this time.
And the next question is, how can an overseas pharmacist can apply for PEBC?
So the first step is they need to create an ID with the Gateway Canada. And when they create the ID, then they will get the NAPRA ID through. And once after getting the NAPRA ID, so they need to send all the documents for the evaluation. So the main document that they need to evaluate is their transcripts from the university. And the other thing is they also need to send their pharmacy license in case if they are already registered in their home country, then they need to send the pharmacy license or the good standing certificate from the pharmacy council. So these are the main documents that are to be sent directly to PEBC. And for Canada, it's not like Australia, APC. So for Canada, we need to send all the physical copies right away up over there. So we need to send all the physical copies. Then also our photocopy of our passport or any other ID card, our identity card, which bears the photo bearing ID card. Then the case officer, then they will assign the case officer. Then the case officer will go through all the documents, and they will take at least 2 to 3 months time to verify the documents. And once it is done, then the case officer will give eligibility to sit for the first part of the exam, that is the evaluating exam. So this is the thing that happens. Like at first we need to create the we need to get our NAPRA ID through Pharmacy Gateway, and then document evaluation, and then we need to sit for once we get the evaluation done, then we need to sit for the first part of the licensing exam, that is the evaluating exam.
Yes. So as Alf was saying, like the first and foremost step is for any international graduate who graduated outside Canada is to enroll in a pharmacist gateway and get a NAPRA ID. So that will be the first step, just to stress on that. So getting a NAPRA, I'm enrolling in pharmacist gateway and getting a NAPRA ID. And then you will apply for the document evaluation. But as Arif said, like all the documents are sent, mailed. When I say mail, it is like the copy is physically sent to the PEBC from your university. That will be directly sent to the university. It's not you're emailing it. When you say mail, you're sending physical copy.
Yeah.
Yeah.
And Shama, the other thing is that like most of the candidates, they were asking, they asked me that like how long does the case officers, they take the time to evaluate our documents and they give the eligibility to sit for the exam. So as far as I know that when I checked with yourself and with other Canadian pharmacists, they told me that roughly takes around 2 to 3 months. So is it the same situation right now, or has the situation been changed?
It's 2 to 3 months now, still, but as I said, like when you mail everything to PEBC, like
Yeah.
they make sure they have everything as they have mentioned it on their website. So sometimes candidate miss like something like even if the transcript is sent from any university directly to PEBC, they have to follow the requirement that is mentioned by PEBC. If anything is missing, like a seal or signature or anything, then PEBC will hold your case. Then you have to start it again. So that will delay your process. So when you say 2 to 3 months, it means like when PEBC have all your documents right in place, then your process and case starts, and it take 2 to 3 months to get your documents.
From that point, yeah, exactly. Yeah. So as long as if there is any delay from our end, like sending any documents, then obviously it will prolong, like it may take more than 5 months or 6 months in the process.
Yes.
And like the other thing is that PEBC has started like till last year, they used to conduct the PEBC, that is the evaluating exam, only twice yearly. But from this October, they have changed, like they are going to conduct it 3 times a year. And from 2025, they are going to conduct it 4 times a year.
Yes.
So it means that there is a high chance for the candidates, like whoever they have missed the but like whoever they have missed to give the exam either in the month of Feb or in March, then immediately they can go for the next attempt, like in June or something.
Yes, that is correct. So if initially it was like we could attempt only twice in a year. Now we can do, now we can do 3 times in a year, which is good. Like we can have more opportunities in 1 year. Also, they have changed the questions from 200 questions to 150. When I did my evaluating exam, we had 200 questions and we had 4.5 hour long exam. So it was pretty long, but now it's only 150 questions. But the passing criteria is still 60%, and there is no change in the syllabus. They just increase the number of attempts and reduce the number of questions, which is good for candidates. Yeah.
Okay. Yeah. Yeah, that's good to know. And also like as for PEBC, like recently they have introduced that like online proctoring or the remote proctoring system. Okay?
Yeah.
So through which the candidates, they can also take the exam by sitting at home. So this is another advantage of the PEBC at the moment.
Yes. So I think the proctoring started when I appeared, when the year when I appeared for my evaluating exam. That was like the pandemic era. So I was in United States, and like we were trying to appear for the exam, and then due to the pandemic, they launched this remote proctoring thing. So everybody could write from their home, which is like which will save a lot of time and money, like because you don't
Yeah.
have to worry about going to a test center or anything. So they continued it. So when I appeared for my MCQ, and I still emailed them and asked, like, are you going with the remote proctoring still? They said, we haven't changed remote proctoring. It's still going on. So
Yeah.
that's a great advantage for candidate nowadays. Yeah.
Yeah. Yeah. Thanks for that. Yeah. Thanks, Neha. See you. Okay, Shama, like I guess Neha, she might be having some technical issues.
Yes,
Okay.
sir. And sorry for the disturbance. Actually, there is a power outage here due to rain. And
Okay.
as Shama said, during document evaluation, if there are some mistakes, it might take like little long time for us for our documents to get evaluated. Is there any chance for rejection like during document evaluation?
Like, I don't think so. Like, in case, as long as we submit all the documents, okay, so whatever the documents that the case officers they ask, so if we submit all the documents, then there won't be any chances of rejections. So the same thing like with KAPS as well. So at first, we need to submit all the documents, and then the case officer, they will ask some other additional documents. Okay? So when we keep on fulfilling like what will be the documents that the case officers they ask, then if we send all the documents, then definitely they will go through those documents, and they will give the approval to sit for the examination. So there won't be like I haven't came to know about any cases like they have completely rejected or denied the candidate to sit from the exam.
Yeah, if you're a 4-year undergraduate, like pharmacy graduate, then you are eligible to do your document evaluation. So that's the only criteria they have. And plus they have some specification in sending this transcript. Sometimes, as I said, like we are sending it from a different country. And the universities are so hectic, and they might miss something like a signature, or they are not, it is not properly sealed. So some mistakes can hold your case. We can still redo it. It's not like they are rejecting you.
Okay, yeah.
Yeah.
Yes, thank you, Shama. And we have a question during live also, sir. There is a question from Shoaib. Like, what is the total cost for PEBC exam, including document evaluation?
Yeah, for the cost, like actually I made a video on YouTube. So like where I have clearly explained about the different stages of the PEBC, like how much does it cost for the first stage, that is for the evaluating exam. Then also we need to, how much does it cost for the qualifying examination. And some provinces, they also ask us to do the bridging courses or the bridging program. So we also need to calculate that amount as well. Okay, so I recommend to have a look through that video. So in that video, it clearly mentions that how much does it cost, the total amount.
Yes, sir. As we have a detailed information throughout, it's a long video actually.
Yeah, exactly.
Yeah, it's a bit expensive. Like you have to pay for document evaluation and evaluating exam and both qualifying exams.
Yeah.
Yeah.
And Shama, there is another question like regarding the bridging course. like many candidates, they were asking that, do we need to do the bridging course? Is it mandatory for everyone? So can you just give an overview about this bridging course?
Yeah. So, pharmacy bridging program, as the name implies, it's bridging a foreign graduate with the Canadian standards. So, they are like training you to match with the skills and experience of a Canadian pharmacist. So, it could be like a 8 to 10 months long program. And so, initially, provinces like Alberta were their bridging program was mandatory. But now in provinces like Alberta and Ontario, if you clear all your PBC exam in your first attempt, then you don't have to do your bridging program. So bridging programs can be expensive too. So like that's a good thing that if you clear all your PBC exam, this is why you need proper guidance to appear for your exam so that you can clear everything in the first attempt and you don't have to go with the bridging program. But province like British Columbia, I think it's still you have to do bridging program. I think it's 8 months long. So sometimes people get confused a bridging program as like a preparatory course for PBC. So people just go and join for it. But as I learned, bridging programs never prepare you for a PBC exam. It is just making you getting ready for working as a pharmacist. Yeah, PBC is testing you separately. So you need a proper guidance for PBC exam. Don't consider bridging program as a preparatory course for PBC exam. You have to do bridging program only if the province mandates it. Otherwise, you can skip it.
You can skip it. Yeah. So that's the interesting thing. Like if we clear the exam, for those whoever they clear the exam in the first attempt, so they need not to do the bridging course. But those who won't clear the examination, if they fail in any one part, okay, so either in the even if you have cleared the evaluating the first part and then you have cleared the MCQ part of the qualifying examination, but you have failed the OSCE in your first attempt, then you need to go for the bridging course. So it means that it will cost you a lot. Like there are some bridging courses depending on the province. Like there are some provinces where the bridging course will go even up to $8,000, $10,000, $12,000, $14,000. So this is the extra amount that you need to pay out of your pocket. And so that's why preparation for the examination is it is very important. So if you prepare well for the examination and if you can clear the examination in the first attempt, then you need not to waste your time, and at the same time you need not to waste your money. Otherwise, you need to spend a huge to do these bridging courses. And as Shama clearly mentioned that through these bridging courses, they are not helpful as a preparatory for the PEBC. So you can't learn anything from this bridging course, especially to clear this exam. So the same thing, like even here in Australia, we have got the intern training program. So intern training program is mandatory for all the intern pharmacists. But during the intern training program, we learn a lot. We learn many things, how to like once after becoming a pharmacist, how we need to perform and so on. So those things that we learn, but during intern training program, so they won't train us much for clearing the examinations. So the same thing even for the bridging courses in Canada. Like these are the courses, like they help us to know that how the pharmacy need to practice in the future, but not for clearing the examinations. So that's why while preparing, we must prepare well to clear all the exams in the first attempt. Otherwise, it is a punishment. It's just like a punishment or a fine. So we need to go for bridging course, clear that bridging course, then only we'll get the eligibility to sit for the exam again. If we don't do the bridging course, then we can't write the exam again. So we need to pay the money out of our pocket and finish the bridging course and then again apply for the exam.
Exactly. So what happens is like sometimes people apply for MCQ and OSCE together. So it's good to apply for both together because both complements well. But if you fail MCQ, then you cannot apply for OSCE until you clear
the
MCQ.
MCQ part.
Yeah. And same like as you were mentioning, like some province say like you have to go for the bridging program before you apply for OSCE. So it's like you are spending too much time and money again.
Exactly.
Of
Yeah.
course, bridging program will be an asset for you when you practice as a pharmacist, but it
Yeah.
really you have to get separate coaching and guidance to appear for the exam.
For the clearing the exam. Yeah.
Like doing smart work in the it's not about an exam, but managing their three steps of exam. As Shama said, compliments well for the PEBC. I must say that. Is that true, Shama? Like
What is
it
that?
can save both money and time. To save money and time, like
Yeah.
we need to give our exam for the we need to clear our exam in the first attempt. And
Yes. And we, as everybody knows, our number of attempts in PEBC exams are also limited. Like we got only 3 attempts.
3 attempts.
So
Yeah, exactly. Yeah.
you'll be more relaxed when you're doing your first attempt, but as the attempts goes by, like when you're like on third, it's very stressful. Like, you know,
Exactly.
the stress itself can affect your performance because you
Yeah.
are like almost close to your last attempt.
Last attempt. Yeah.
Yes, so that can be stressful too. And after third attempt, you'll get a mercy chance, but that is again like you have to go through a lot of process to get that one more chance.
Yeah.
So all those add to your stress. So that's why how you prepare and how you approach the exam is really important.
Exactly. Yeah. As you mentioned, Shama. So, like, whenever the candidates they are giving the first attempt, okay, so like they will be during that stage they will be a bit relaxed. But when candidates they lose the exam in the first attempt, okay, then they start developing a lot of nervousness when they start preparing for the second attempt. Okay, then they will have a lot of nervousness, and even if they lose the second one, then it will be a big pressure for them.
Yeah.
Okay?
Yeah.
So to clear that exam, because it's the end.
Yes.
Like in case if they won't clear it in the third attempt, then they can never become a pharmacist in Canada unless like they need to get a special permission or the approval to take the fourth attempt and to do it.
Yeah.
So yeah, that's why a proper preparation is much important, okay? And with a proper guidance is much important for clearing this Canadian PEBC examination.
Yeah. So I have seen like candidates like who lost 3 attempts in the evaluating exams and trying for their last chance of the mercy attempt or fourth attempt.
Yeah.
So before that, they have to go through a lot of CEs and everything that is very expensive.
Okay.
Like, they have to go additional courses and certification before they go for the last chance. So it can be stressful and expensive too. So
Expensive as well, yeah.
yeah.
And sir, sir and Shama, like what are the visa opportunities for a PEBC qualified candidate in Canada?
So for Canadian pathway, the visa pathway, like we are going to conduct a special live session, live webinar. Okay, so where we are going to invite the migration lawyer. Okay, so the migration lawyer will talk about what are the visa options and how they can move to Canada and so on. Okay, so we are going to soon. I'm going to announce another date. So where we are going to conduct a special session only for the visa options.
Okay. Like Shama, is there anything you want to add with?
Yeah, my knowledge in that is limited, but as I learn, like there are different pathways for healthcare professionals. So healthcare professionals job market is, including pharmacists, is a bit steady here. So programs like Express Entry and provincial nominee programs are still helpful for candidates to apply for PR or get into Canadian healthcare system. But as Arif said, like an immigration consultant will be like more, they will be having more awareness about it.
Okay, sir. And what is next after PEBC and after getting into like Canada? What if like PEBC qualified candidate must do? And is there any internship program? If yes, what is the duration of it? And is there any licensing exam after finishing the internship program?
Yeah, Shama, you can just tell about these things. So
Okay.
regarding the internship and because many candidates they asked me, because I
Mhm.
know like here in Australia, it is a common internship for all the candidates. They need to do it for 1,575 hours. Okay,
Oh,
so that's the intern hours in Australia.
no.
But I came to know that in Canada it differs from from different provinces. So can you just briefly explain about it?
Sure. Another challenging thing about Canadian licensing process is there are variations among provinces. Like, so each province will have a pharmacy regulatory body. So they have the power of regulating the pharmacy practice in their province. So even if you clear all the PEBC exams, of course it's a national exam. So then that will be you will be allowed to practice anywhere in Canada once you clear all the PEBC exams. But for each province, their regulations and standard again differs. So the internship is under province and territory. So each province will have a structured practical training or internship or like PACE. So they call all this in under different names. So you will have to apply the provincial regulatory body, like a pharmacy board of that particular province, and they will say like how many hours you have to do. So the province where I am practicing, it's called Newfoundland and Labrador. There, my internship hours was 1,200 hours. So there are some provinces where your internship can be longer than that, and there are some provinces where your internship can be shorter than that. So provinces like Prince Edward Island or Manitoba or Ontario, then the internship is like 3 months long. But province like Newfoundland or British Columbia, it can take from 8 to 10 months. So it varies among province. It's a bit confusing in that way. And for your internship, you will be doing your internship under a preceptor or an assessor or evaluator. So though they will be also registered with the provincial pharmacy body. So one preceptor can have only one intern at a time. So when you do internship hour, this many internship hours under each preceptors. So in this province, I had to do under 3 different preceptors in 3 different community pharmacy setting. So each preceptor will what they will do is at the end of your internship hours, they will do a slight a small evaluation or assessment based on your performance. So how much you learned, how much knowledge you acquired throughout your internship process. So they will ask a couple of questions. You'll have a discussion, one-on-one discussion with your preceptor, and they will have a particular assessment sheet that will be confidential, that will be with them, and they will do the assessment and send to the pharmacy board. So once the pharmacy board says, okay, this is okay, they will approve our internship hours. So that's the process with most of the province. So there will be a small evaluation or assessment at the end of your internship, and that assessment will be sent by your preceptor to the provincial pharmacy board, and they will approve it. So that's the process.
And Shama, one more one more quick question. Like during internship, are we paid? So do we payment during the internship?
Yes. So in the province where I practiced, like I got paid internship hours, but even some province that is very short for 2 to 3 months, they are like there are unpaid internship hours too. So it's again, it depends on what employer employed you as an intern and what are their regulations.
Okay. Yeah.
It can be paid and unpaid. Yeah.
Okay.
If it is a longer internship, it will be definitely a paid one.
Okay. Yeah. Thank you.
There is a question regarding like provinces thing. Like Deepak is asking, like, I want to become a pharmacist in Alberta. For this, do I need to take bridge course in Alberta College of Pharmacy to practice as pharmacist in Alberta?
So Deepak is from Alberta, you said?
Yeah, he wants to become a pharmacist in Alberta.
Okay, so Alberta was the province where the bridging program was mandatory. But now they have removed that, and they says like if you clear all the exams in the first attempt, then you don't have to do the bridging program. So you can skip it. But again, like it keeps changing in a year. So the year which you
Okay.
register, you have to go through the provincial regulatory body and see the requirements. As of now, they have removed it. So we cannot predict like next year if they're gonna
Okay.
change it again.
Exactly. Yeah.
Yeah.
Thank you, Shama. And can we skip into the like finances pro thing? Like, what is the total cost if we become a pharmacist in Canada? Like, from starting from the document evaluation till we come to Canada, like, what are the expenses? Like, can you please differentiate them and just give a brief thing on the finances, Shama?
Okay, so when I did my document evaluation, the documentation evaluation fee was around $860, and evaluating exam has a fee of over $1,000, and qualifying exam again is expensive and it's around $1,500. And OSCE is the most expensive one, and the fee is around $2,000. So for just document evaluation exam itself, we should be paying around $5,000 to $6,000. So it's apart from, it's for the first attempt. So if you're clearing everything in the first attempt, for just exams, you'll pay $5,000 to $6,000. But the good thing is, when you get registered as a pharmacist, like when you get registered as a pharmacist or you do your internship and you're committing yourself to work as a pharmacist under an employer, some of the employers reimburse the cost of your exam.
Oh,
Which is
that's
like a very
good.
good thing. Like, so when I worked as a pharmacist, I got my exam fees and everything, my license process, like licensure fees for all the process got reimbursed
Yeah.
through my employer. But again, like they will cover only one attempt.
Exactly. Yeah.
Yeah, they'll cover only one attempt. So once you clear it, they will pay for your all your licensing
Okay.
process, which is a good thing.
Is it
Exactly.
for the Canadian population, or even it is for overseas candidates, Shama?
It doesn't matter if you get registered in Canada as a pharmacist after clearing all the exam and you are signing a contract with a company to work as a pharmacist in Canada. That
Okay.
company will it varies from companies. Not everybody will, but most of them reimburse your licensure fee, like all the process. They will evaluate what all process you went through. So for me, as an international graduate, I had to do some extra steps, right? Compared to
Okay.
Canadian graduates. So when they hire a Canadian pharmacist and an international pharmacist, of course, going through some extra steps. So I had to pay more, like for my document evaluation and evaluating exam. But my employer covered all the expenses.
Okay, that's
Which
nice.
is
Yeah, exactly. So it's nice to know that when they are covering all those expenses, so it means that we're not spending any money from out of our pocket. So initially we are spending, but again we are getting all that money back. So whatever the amount that we spent for the examinations, so we'll get that money back.
Yes.
Okay. Like Shama, what is the pay rate for an intern pharmacist for a PEBC candidate?
Okay,
in
so
Canada?
if for working as a pharmacy intern, your pay can be around $20 to $25 per hour.
So,
Is
but
it far? Yes, sir. Please continue.
yeah, but once after becoming a pharmacist, how much salary that they can expect, Shama?
Yeah. So once you become a pharmacist, your average salary can be around $85,000 to $120,000 per annum.
Okay.
Pharmacist is a well-paid job in Canada, and the job market is, of course, steady. Plus you will get like apart from your salary, of course, you will have incentives and bonus, and as I said, like they'll reimburse the licensing and fees
Exactly.
and everything. And in every year we need to renew our license through the pharmacy body. It can be expensive too, like $1,000 to $2,000. So most of the employer cover all those expense.
Yeah. So that's a good thing. Like when the employers, they are reimbursing all the examination fees, and also they are happy to cover our annual registration fees. Then it means that we are not spending any amount for these exams or for our registration, the annual license. So that's very good thing that we can know about the practice there in Canada. Unfortunately, it's not available in Australian practice.
Oh, really? Okay.
Yeah, so we can't get that sort of the reimbursement, or we can't claim anything from the employers for the annual license registrations. So everything the pharmacists need to bear by ourselves.
Okay.
Hi, sir. Hi, Shyama.
Hi,
Hi,
Ashita, how are you?
Very good, sir. We are getting very number of questions like, why choose elite expertise for, they like audience have known about KAPS. If we name KAPS in Google or if I ask any students for KAPS, intern oral, elite expertise with the brand ambassador, it has become just like a brand. And they have very nice question coming, like why choose elite expertise for PEBC? So, Neha, you have been a student of elite expertise for KAPS, right? So, how do you suggest the students? Like, we'll take a conversation from the student perspective, a teacher perspective, and a Canadian pharmacist perspective, so that the audience will have a nice rapport and they'll get to know what is all. So, coming to you, Neha, I just ask only two to three questions. I'll disappear because audience are liking you more. Yeah, so on a student perspective, what did you learn from elite expertise, Neha?
As you all know, I have cleared my KAPS examination from Elite Expertise in just 30 days under the guidance of Harika ma'am and Arif sir. It was very tough actually for me to to put everything at a place just before my 30 days of preparation. But Harika ma'am and Arif sir just held my hand and they just drive through the process. They asked me to just trust the process and give the exam. I just learned we need to trust the process. We need not, there is nothing to rush. And their quality of education is something which marks it's top level. Like being an average student, I could clear my KAPS examination in the first attempt. I can just say not like I'm short of words just to say thanks to them. That's it. I have said this in many platforms and
Yeah.
I can say this here too.
Yes. Arif sir, why did you were going very good with KAPS, intern, oral, return, and everywhere. Why did you start this PEBC exam? So what made you to start PEBC exam as a pharmacist for the pharmacists, mainly for the overseas pharmacists?
Overseas pharmacy. Yeah, it's an interesting thing. Like again, I just want to share a little bit of the journey regarding the KAPS as well here.
Yes.
So I did my KAPS examination back in 2016. Then after clearing my KAPS examination, I came to know that many of the candidates, like they were facing a difficulty in clearing the KAPS examination. Okay? So they have faced a lot of problems, or they have faced a lot of issues in clearing their KAPS examination. And they have contacted me and they asked me to help them out in clearing this KAPS examination. Then I started providing the training to them. And soon I started providing the training. I have helped like more than 800 candidates in clearing the KAPS examination in their first attempt. Okay? So like it became a very good the efforts that we made, okay, in clearing this KAPS examination. We helped the candidates in clearing their KAPS examination. So those efforts, we all can see, everyone can see the results that what we are getting from elite expertise. And now the candidates, they also asking us to help them out in PEBC, in clearing the Canadian PEBC examination. So everyone knows that Canadian PEBC examination is a bit tougher exam in the world, and it's a big challenge for the candidates to clear this examination, especially in the first go. So when the candidates, they approached me, then I took some time, more than 8 months time. So I did a lot of research on the PEBC, and I consulted a lot of pharmacists. So one of our pharmacists is Shama here with us. So I consulted her. I took a lot of advice from her, and also I consulted a lot of other pharmacists who are Canadian pharmacists. They are currently here in Melbourne, and they are practicing in the top hospitals as a clinical pharmacist. So by taking all their advices, so we have finally designed this program, the PEBC program for the candidates, to make sure that the candidates, they can easily clear this PEBC examination in their first attempt. Like how we made the KAPS pathway, KAPS journey, so easy for all the overseas candidates. So we are going to give the same type of the efforts at Elite Expertise, and to make sure that the candidates they can clear their PEBC examination in their first attempt.
I have 2 more questions for you, Arif sir.
Yeah.
If we see, people will be asking, I have passed KAPS, what's next? So they'll be having, n number of questions in their mind that, I have this amount of thing, that amount of thing, I have invested so much time, my time is getting wasted, I have 80 points, 70 points, 60 points. So as a driving force, you are the director of Elite Expertise, and we are, you don't treat us like normal. We are the employees. And whenever we come down, you say that, no, for every problem, there is a solution. You show us the solution. So, what do you say for the pharmacists, sir, who are just waiting for that urge? Because we know how much struggle you have faced to be in this position. And, teaching KAPS is not an easy thing. Becoming a consultant pharmacist is not an easy thing. And top of it, you have a 2 years daughter in hand who is always round around you. And
Yes,
hardly you, your son, and hardly you sleep only for 2 hours. What's the driving force, sir, to have all this? And
How
you're
come
very,
you secure all the energy? Like, it's not a single day thing. It's like around the clock. Every day you
Yes.
will be on with the same enthusiasm.
And
Not
the
a few.
material which you provide, I come from a techie background. If I read, maybe even I can understand. It's so layman, sir. It's like even a non, no, I should not say student is average, below average, or, intelligent. It depends upon the caliber. How can you understand that, Ashrita can pass? If Ashrita can pass, Neha will ultimately pass. How did you design? KAPS, you have designed it ultimately, sir. How did you design the PEBC, study structure and everything, course structure and everything?
Okay, yeah, sure, Ashita. So at first, I will answer your first question. That is, what candidates they were thinking about, they have cleared the KAPS and they are waiting for the visa and so on. So for that, I would like to share my journey, my KAPS journey. So I did my KAPS in 2016. I cleared my KAPS examination back in 2016, and after clearing the KAPS examination, there were no openings in Australia, like the same situation how it is right now. So there were no openings during that time, and I was just waiting for to get any sort of the invitation from any states. Okay, but there was all the states were closed, and there was no chance of getting the invitations. So I had to wait. So I cleared my exam in 2016, like October, okay? And since then, I had to wait for almost 2 years. I landed here in Australia in 2018 December. So I cleared my KAPS in 2016 October, and I landed here in Australia in 2018 December. That is almost I have waited for 2 years to get the visa sorted and to come here and start my internship. So it means that it depends. Sometimes it takes a bit time getting the visa and all those things. They are not in our control. So clearing the exams and everything is in our control, so we can do it. But sometimes the Department of Home Affairs, they take a long time to give the invitations. So we need to wait for that. So my journey, I landed here on 2nd of December in 2018. So I cleared my KAPS examination in 2016. So almost I have waited for 2 years to get my visa and to come here. And that too, the type of visa that I got was completely, it is a regional visa. So it is a state-sponsored regional visa, which means that I need to stay in the regional Australia for 2 years. Then only I can move to any other place. So I worked in the regional area. So initially I struggled a lot. I didn't get my internship straight away when I landed here in Australia. So I worked in some other jobs. I did some other jobs as well. So I worked in KFC for a few months. Then after that, I found the internship, and then I started doing my internship. So that's my journey regarding the how I become the pharmacist and the KAPS and so on. So I can say that it takes some time. So we must be patient in this matter, and we need to wait for that timing. And regarding the KAPS examination, the curriculum that I have designed. So as I mentioned, that what is the reason why I designed this KAPS exam curriculum, and what is the reason why I am going to start, like we at Elite Expertise, we are going to start this PEBC. So as many candidates, we know that it's a universal fact that many candidates, they will fail in PEBC. PEBC is not that so easy exam. So many candidates, they will fail in their first attempt, second attempt, and there were candidates who have been messaging me. So they have messaged that they have been trying for this exam for more than 7 years. Okay? And they were saying that this is my last exam, last attempt. So if I fail in this attempt, then I can't, I need to just lose my hopes to become a pharmacist in Canada. So they have been texting me many times. So I thought that I need to like develop a program for PEBC. So we just developed this PEBC program in such a way that as how we made the KAPS so easy, like how we made the KAPS so easy, providing the ready-made nuggets to the students in a similar way. So we made the PEBC that's so easy that all the candidates, they can confidently, they can attempt that exam and they can clear the examination.
So why did you design the PEBC course for 6 long months? There are many institutes, they'll just give for 3 months, they'll give, MCQ questions, not to keep it a negative thing, but just like asking you, they'll just give you the marks. But why are you concentrating to have a, teacher-student relation, having the live lectures twice a week, giving them marks? Why did you design the course structure in this way? What's the reason behind it?
Okay. So first of all, I would like to tell that regarding even for the KAPS examination, the training that we provide to the students. So when compared to other institutes who are providing the same type of the KAPS training, okay, when compared to other institutes, so all the other institutes, they will finish all the lectures like within 60 hours or hardly up to 80 hours. So they will spend only 60 to 80 hours in finishing all the KAPS course. Okay. And then they will say that, okay, the curriculum, the whole syllabus is done. Now it's your job. You need to keep on doing the mocks and you need to keep on doing the revisions and prepare for the exam. But here at Elite Expertise, we take we will be taking the classes for more than 300 plus hours. Okay. So for the KAPS examination, so we have been taking the classes for more than 300 hours, 300 plus hours in each batch, with multiple revisions. Like every day we'll be keep on taking the classes. Like Neha was there. Neha is also one of our students. So from morning, we'll start the classes from morning and it will end till night, 9:30 p.m. in Australian timing. So we will start the classes in the morning and we'll end it till night. So that is 1 month before the examination. So when students, they need a lot of revision. So 1 month before the examination, we just hold their hands. We won't leave them. So we keep on taking the classes every day and do a lot of revisions to them. So that the candidates, they will never forget on the day of the examination when they see such a type of the questions on the screen. So they will never forget.
That's really true, sir. And I would like to add my personal experience too. Like I was very confused before you start the revision classes. Like since I had very less time for the preparation, I was very confused. But when you start the revision, like you haven't started the revision like with the sake for it's not like turning the papers and all. You have started revision too from basics again. If there is a question, you are doing back study. Like why is this? Why is this? Why not this? How can we check the correct answer during the exam? Like you have spent almost 7 to 10 minutes for each question. I remember it because that was very helpful during my exam too. It's just because like we have got 95%, 96% and 100% recently. It's not just the thing. It's not very easy actually.
Yeah.
Like even how the candidates' efforts are 100%. It's all your efforts, sir. Like the major thing is it's all your efforts. It's ma'am and sir's efforts. Like the candidates' efforts are just minimal actually. That's all I can say. Thank you. And over to Ashita, ma'am.
So 2 more questions.
Yeah.
We have one of the burning question on LinkedIn. What does the Australian clinical pharmacist day starts like?
So the Australian Clinical Pharmacist Day, like I can say that it will be a very busy job. Okay, so
Okay.
it's not that so easy.
Okay.
Like not only Australian clinical pharmacists, it is also for Canadian pharmacists, for pharmacists those who are practicing in US or in UK, everywhere, all over the world. Okay, so their job will be like they need to handle a lot of things. They need to take care of a lot of things. So especially when we are in the clinical sector, in the hospitals, so when we are working in one specific ward, okay, it means that we are not just focusing on the patients, those who are on that ward. So we also need to take care about all the other wards and all the other things which are going on. So yeah, so it starts early in the morning and it will just keep on going and till 5 o'clock in the evening. So we will be so busy. So especially the thing is that the main thing is like we need to keep on communicating with the doctors. Okay? So we need to keep on asking them to make changes to the therapies and so on. Okay? So because in clinical side, especially in the hospital side, all the decisions like whenever the doctors they chart certain medications, especially for certain antibiotics. So again, pharmacist responsibility to cross-check them, and we need to give the approval. Then only the nurses they can administer those medications. So we have got a lot of tasks to be done, okay? And yeah, the whole day the pharmacist will be busy and they'll be
Is the
doing.
same is the same for the clinical pharmacist? What he does in Australia is same to the clinical pharmacist. What he does in Canada, US, UK, and everything is the same, or anything different?
There won't be much difference. So in almost all the countries, the roles and responsibilities, like what we need to do, so everything that remains the same. Okay. So the practice standards, I can say that the clinical practice standards in US, Canada, Australia, UK, so in all these countries is almost the same, the clinical practice standards. Especially I'm talking about the hospital practice standards. But of course, like in certain countries, like in Canada as well as in UK, even in US as well. So the pharmacists they have got certain other extra benefits, like they also have got the prescribing rights. Whereas in Australia, we haven't got it officially, but still it's ongoing. Okay, so these are certain differences. But apart from that, almost all the other practice clinical oriented things they remains the same.
Okay, so over to Shama now. Two more questions, Shama. So Shama, what does the clinical pharmacist in Canada does?
Okay, so as I was mentioning, the clinical pharmacist jobs is very similar to what he does in Australia. So they are more focusing in hospitals and they are like managing the therapy in hospital. So it's different from India, where in India you can get all your retail medications through hospital pharmacy too. But here in Canada, the hospital just work exclusively for the inpatients in hospitals. They don't deal with outpatients at all. So outpatients are dealt with retail pharmacies and community pharmacies separately. So inpatients will have a more complicated regimen, and clinical pharmacists will collaborate with other healthcare professionals to modify their therapy and monitor their therapy.
Oh, okay. And do you have come across any complex case studies or something? In the OSCE exam, for the evaluating exam, we have statistics kind of thing, right? Many complicated subjects and all. So what did you do for that? Any tips and tricks?
To appear for your OSCE?
For the first evaluating exam.
For the first evaluating exam, the major challenge is I got graduated in 2015, and then you're appearing for evaluating exam 4 or 5 years later. So that's a long study gap between your graduation and you appear for a national exam in Canada. Yeah. So we almost forgot what we learned. We are learning everything new.
Yeah.
Yeah. So, but you should always know like what areas to be concentrated. Like you
Yes.
should not be stressing on one particular area too much because every question is marked equally. You get
Okay.
one mark for all 150 questions. So when you spend too much time like just one topic, then you will miss all of them. So it's better to have an understanding of everything rather than having mastering just one area. Sometimes people spend lot. Time management is very important for your PBCs. Like time management, if you don't have a proper time management, doesn't matter how much knowledge and skill you have. Because you have like 3 hours and 150 questions in front of you. And each question is marked like 1 point for each question. So each question carry equal weightage. Sometimes candidates spend too much time on questions. So, and they will skip the rest of the questions. So time management is another tip.
That's why maybe we have designed mocks on this time management, I
Right.
believe. Yeah,
So-
so has designed it.
Yeah, so mock is very important. Like, so like you have to do your mocks and make sure you can manage this many questions in this many hours.
Yeah.
Yeah.
Especially calculations and everything, you have to practice it daily so that you can solve it in 1 minute.
Mm.
Yeah, if once you take more than 1 minute, then you are losing the chance to answer the even the easy questions. You know, at the end, people will flag everything, and at the end they don't have time to go back.
Yeah. A very conceptual study, maybe this will take place the more part, maybe this will have more figure kind of a thing, I believe, Sham. So, Shama, there are like two major questions. If a candidate is there, if I am a pharmacist, I'm in my final year of pharmacist. So, if I'm thinking to move to Canada, so what I have to do from the starting?
So I would say like you can, if you're a final graduates of Canada, pharmacy, any pharmacy graduate program, then you can start working towards your PEBC.
Okay.
So because you are so fresh, like you're in college,
Yeah.
you're already studying, like, it's not like you have stopped studies and then you're applying for it.
Yes.
So you can start preparing towards your PEBC exam. So now they have the remote proctoring option. You can make and attempt your exams from inside your native country. So once you move to Canada, you have cleared the PEBC exam. Now just you have to go through the province and get registered.
Yeah, understood. And one difference we have been getting many questions. People are, they're failing the evaluating exam in the first attempt. They're passing in the second attempt. Again, they are failing in the MCQ, the second part, qualifying exam. So what do you say about that?
Okay, so that is like there are too many candidates who have that situation. Like,
Yeah.
so when I did my evaluating exam, when I learned my clinical or management or Canadian law or Canadian healthcare part, I studied it in 2D so that it was easy for me to apply for my qualifying exams. Because all this will get tested in depth in MCQ and qualification, except the biochemistry and chemistry, and all those are like just for evaluating exam. But I'm talking about the clinical and the management side. So that will be tested in a basic level in evaluating exam, but that will be tested more deeply in your qualifying exam. So evaluating exam, you spend time and try to understand all this topic in depth, so that MCQ will be a breeze.
So you mean to say if they have a good, that base, like how a cake has a good base, then the foundation will be good.
That will be the evaluating exam, that your foundation will be evaluated. So you are building on it. So once you go for clinical and management in depth, when you go for MCQ, you're just practicing question. You have already built your knowledge.
So there is no change. Everything is the same.
The question pattern is of course different.
Yeah.
It's very different.
But the conceptual level, like, what sir has designed, like you, sir, ma'am, and everyone has designed, they have made evaluating exam course for Elite Expert in such a way that they made MCQ and OSCE level also, they have made very easy. Like they made the base for it.
Yes.
So, yeah.
So
Yeah.
exactly
Sometimes go ahead.
Sorry, guys. So as Ashita has asked me that why 6 months of program for at Elite Expertise. So whereas other institutes, they are providing it only for 3 months or for a short course. So this is one of the main reasons, like we have designed our course, like myself, Shama, and we all together, we have designed the course in such a way that the candidates, they can learn from the basics.
Yeah.
So they can learn everything from the basics. If they have a strong basic knowledge, then easily they can apply those knowledges, and we will teach each and every concept to the candidates. Okay? So we are not rushing like just to finish our whole curriculum like in 2 months or 3 months, and then rush and ask the candidates that, okay, now everything is done, it's your part, go and appear for the exam. So we are not going to do that. So we are going to build their conceptual knowledge. So we are going to teach them each and every concept, so that it helps them not only to clear this first part of the evaluating exam, the first part that is evaluating, but also it helps the candidates to clear their, it also gives them a very basic foundation for them to clear their other parts of the exams as well, like the qualifying examination. So that's what is happening with the Australian KAPS as well. So even for the KAPS, we are teaching each and every point that is actually, which is not required for the first part. There were certain things like every day we keep on discussing our clinical experience once after coming back from the hospital. So in the evening when we take the lectures, so we present like whatever the cases that we come across in the hospital. So we discuss those cases with the students. So the students, they will keep on learning all those cases. But in fact, those things are not required for them to clear their first part of the exam, that is for the KAPS exam. But all these are essential for them for the next part, that is for the intern examinations. But they are gaining a lot of knowledge from this class. So
Yes.
they will develop a lot of conceptual knowledge, and these things are helping them to clear their other exams as well.
If we see the conversation which we are having, even it's live, so we don't have anything. It's like conversation, one-on-one, sharing the inputs of. So that's all from my side, sir. We have many audience question. The live will go on, sir. We have many audience question powering up. Neha, you can have take the questions from the audience as well, dear. They're
Sure.
asking about the evaluate exam, why choose elite expertise and all. Yeah. Thank you, guys. Bye-bye.
Thank you.
Yeah, thanks.
Thank you,
Ashita.
Ashita ma'am. Sir, before jumping into the next questions, like, can you briefly tell how Elite Expertise has designed PEBC coaching? Like how many months it is, like in a week, how many classes we take, and what is the fee charges, and how to enroll? Like what is the limitation? Like how many months can we take? Like if we fail in the first attempt, can we continue the same process for the next attempt too? Please,
Yeah.
in your words, sir.
Yeah, sure. So at Elite Expertise, as already we have designed our KAPS training. Okay. So now we have started, like we have introduced this PEBC training, and even for our KAPS training, the fees that whatever that we charge. So when it means that when once the candidates, they pay the fees until they clear the examination, they need not to pay even a single dollar. Okay, so it means that when once they pay the fees, so until they clear the examination, so they can be our students, and they need not to pay any fees for any extra charges or extra fees. So the same thing even we have implemented for PEBC as well. So once they pay the fees, okay, so just one-time fees, and they need not to pay any further fees until they clear the examination. Okay. So it means that we will take the complete responsibility of the candidates to make sure that they clear the examination, and we are not going to charge any other cost from the candidates. Okay. So this is about the fees for PEBC, and our actual fee is $1,500, but for the first batch till August, so we are giving it only for $850 at the discounted price. Okay. And then the other thing regarding the course or the curriculum design. So we have designed the curriculum in such a way that our course is mainly, so we are not focusing only on one subject. Okay? As Shama has clearly mentioned, that if we focus mainly on one component, okay, then that's the big mistake that we are going to do, like the candidates, they are going to do in the PEBC. So most of the times, like candidates, they think that, okay, pharmacy practice, it carries around 50% weightage. Let's focus completely on the pharmacy practice, and we can try to get up to 40% or 45% only from the pharmacy practice, then just if we score up to 45%, then just we need hardly around 15% from the other components. So if they keep on spending much time only on one component, okay, then that's going to be a very big mistake. So they need to focus on all the other components as well. So each component should be given the priority. So they must focus on biomedical sciences, they must focus on the social and administrative pharmacy, which carries only 10%, but still they need to score from that component as well. And they need to score from the pharmaceutical sciences, which carries around 25% weightage. So the candidates, they must score overall they need to focus on all the components, then only they can clear this exam. Okay, so we have designed our course in such a way that we emphasize on each and every topic. Okay, so on each and every topic, so we not only focus on main one part. Okay, of course the pharmacy practice is the important one, so we show a full 100% efforts on the pharmacy practice, but at the same time we also focus on the other components, okay, so that the candidates can easily when they see the question on the screen, they can easily answer that question with full confidence.
To add to that, like when I, as I was mentioning, when I appeared for my evaluating exam, everything in the syllabus was tested from top to bottom. They didn't skip anything. They didn't skip any part of the syllabus. So you'll get at least one question from everything. So when I was preparing, I was thinking of skipping chemistry or biochemistry, something like that. But you will get pretty straightforward, easy questions from those sections, so that you can easily score. Sometimes you learn too much clinical, or sometimes you learn too much pharmacokinetic. You still might not be able to answer the questions because the questions can be complicated. But instead, like when you try to skip like chemistry or biochemistry, all those stuff, you'll get pretty very easily scoring easy straightforward questions. So that will add to your pass percentage. So that's why it's important to focus on all components rather than focusing on anything too much.
Yeah. So yeah, as Shama mentioned about it, so we need to focus on all the components. So even from biochemistry, even if we are getting like 2 or 3 questions from biochemistry, but these 3 questions would be the main scoring, and sometimes the candidates, they will lose because of this one, even for when they give one incorrect answer, so they may lose their examination. So it is important for the candidates to know this is because our main goal when the candidate, they are sitting for this PEBC examination, the main target is to pass the exam.
Yes,
so
absolutely.
yeah, the main target is to pass the exam. So in order to pass the exam, they need to focus, they need to know that from which component, from which part, what are the questions that they will get. And as Shama has clearly mentioned, that there are certain components like from chemistry, from biochemistry, okay, from microbiology, okay, some molecular biology or biotechnology, from all these things, they ask the straightforward questions. It means that if you have prepared at least once, and if you have done just one time revision, and on the day of the examination, when you see this question on the screen, then immediately you will give the answer for such questions. So that's why we should never neglect those things. We must focus on each and every component. So that's how we have designed our curriculum at Elite Expertise, our course for the 6 months training program. So we have designed in such a way that all the components will be focused equally, so that the candidate, they can easily clear their examination in the first attempt.
Do we provide any kind of materials, like what like if a candidate wants one-on-one conversation with you, or if they have any doubt during the session, like how are we going to clear those, like what are all we are providing for the candidate if you enroll with Elite if they enroll with Elite Expertise?
Yeah, the first thing is we'll provide the mocks, and also we'll provide the handouts for the candidates. Okay? And at the same time, like how we have designed for the KAPS. Okay? So we are confidently, we are telling the candidates that if you enroll with us, okay, if you attend all the lectures, then you will build all the concepts for clearing this KAPS examination. And if you do our mocks, Okay, and if you attend all the lectures and if you develop all the concepts that we teach in the lectures, then 100% you will clear this examination, KAPS examination. It means that you need not to go and refer any other textbooks.
Okay.
The same thing we are going to implement even for the PEBC. Okay? So they need to attend our lectures. So through our lectures, they will learn all the concepts. Okay, and at the same time, we have designed our mocks. Okay, and also the handouts. So they need to practice through the mocks and they need to go through the handouts. So these are the things that are enough for the candidates to clear the examination. It means that we don't force the candidate to go and refer other textbooks, because we are referring at Elite Expertise. We will do that job. So we will refer all the standard textbooks, all the guidelines and so on, and we will prepare our content in such a way that the candidates, they need not to worry about opening the other books.
Okay. So to add to that, like in Canada, all the clinical guidelines they will keep updating it, like they keep changing the guidelines. So if say like the first line management, if it was like when a year ago something is a drug A, then they might change it to a different one in the next year, because they are constantly doing a research on their clinical guidelines. So Elite Expertise, we will be getting in touch with all the reference constantly, like almost every day, and seeing if there are any changes. So we'll be updating our notes according to the Canadian guidelines. So you don't have to worry about referring to a Canadian reference standards, because we are constantly referring it and updating our notes. It's not that you'll get a note and that will be used for 10 years. We are constantly updating our notes with regards to our references.
Yeah.
So
like for each batch, we don't use the same content. So every time the updates will be coming on. So that's what we are doing even for the KAPS. Okay. So the same thing that we'll do even for the PEBC. So whenever there are updates, so we'll just keep on updating the things.
Like we have a interesting question from Chandra Bobula. Hi, I just wanted to know, how confident is your team with the training program since you're starting your first batch for PEBC?
Yeah. So this was the question even the candidates, they have asked me when I was starting the KAPS. Okay, because even that time the KAPS journey was a bit tough for the candidates to clear the KAPS examination. So I just gave the answer that, okay, so we have designed the program. So once you come and attend our demo lectures, okay, so once you watch our demo lectures, then you will come to know that how we teach. Okay, so we will teach each and everything from the basics, so that the candidates will come to know or they learn all the concepts. So as we spend much and more time, and we'll keep on spending much and more time, and we'll keep on updating our contents and so on. Okay, so all these things, it will help the candidates to clear their exam in the first attempt. Okay, so the only answer that I can tell to them is to attend the demo lecture. So like already I have made a few demo lectures, and also we are going to release few other demo lectures exclusive for PEBC. So just attend those lectures and then you decide.
I would like to add something, like back in July 2023, when Harika ma'am and Arif sir have started Elite Expertise, we have got almost 100 students, like around 100 students. Then we have got 92% in our first attempt, right, sir? Then it is progressing. And today the trademark for KAPS is just Elite Expertise, nothing more. This is our confidence, and hope you all understand what Arif sir is saying.
And doesn't get started in a day, like as Arif was mentioning, he has done like approximately a year research towards it.
Yeah, exactly.
I think he knows more than me. I am still learning from him, even if I'm like,
as Ashita ma'am just asked, sir is very curious to learn things, and like he's very particular about everything, not only about KAPS, not only about PEBC. Sir is very particular about everything. He has very keen interest on each and every topic. He will never leave like, okay, we can just leave this. I haven't heard even a single time from Sir. Like they are very particular about everything coming to the quality.
That's why they are success in CAPS. Like
Definitely, that is for sure. And okay, we can jump to the further questions regarding PEBC.
Yeah.
And like, can we give PEBC from our home country, like evaluating and all the exams, all the 3 steps? Can we attempt from our home country?
So you can do your document evaluation, and as I mentioned, they have launched remote proctoring. So you can do your evaluating exam and MCQ part 1 qualifying exam from your home country. You can do it either through your prometric centers, or you can do it at home. But for your OSCE, the qualifying exam part 2, you have to be in Canada, because it's like a practical examination where you'll have case stations and everything. So that's not a computer-based exam, so you have to be in Canada. But everything else, like evaluating qualifying exam part 1, you can do it at your home country.
Okay. Thank you, Shama. And sir, is there anything to add with? Shama.
As Shama has mentioned that, so we can clear both, like the candidates, they can clear once they clear the first exam, that is evaluating exam. And in case if they are ready to give the next exam, that is the qualifying examination part 1, which is the MCQ based exam, then the candidates, they can book the slot for that examination as well, and they can clear that exam. Okay. So when these 2 exams are done, then the next one will be the OSCE. But yeah, of course, for OSCE, it is completely like just like the oral exam. Okay. So
Yeah.
where candidates, they need to be in Canada and they need to face that exam.
Like in Canada, do we have prescription rights for a pharmacist? Like, if yes, what are the like streams? What are the streams can they prefer? It's general medicine, auto, etc., etc., OTC medications and all. Shama, please, can you just brief?
Sure. Like the Canadian in Canada, like the prescription rights and expanded scope of pharmacy for pharmacists is increasing. So they have launched so many new courses and certification accreditation where you can work as a consultant pharmacist. So where you are entitled to prescribe for certain medical conditions. So we can right now in my province, we can prescribe for minor ailments like acne, hemorrhoids, UTI, GERD, then mild skin conditions, insomnia. Then those are like, I can't remember. There are like many conditions where we can prescribe as a pharmacist. So usually we will one of the pharmacists working there, like if I'm acting as a consultant pharmacist, I'll take care of prescribing and seeing patients and doing the assessments, and the other pharmacists will be running the dispensaries. That's how we do that. And also they have expanded our scope, saying we can adapt the prescriptions. Like if say like they have the prescription, if you have a prescription for an antibiotic, if the dosing was not appropriate for the weight and age, we can adapt it under the pharmacist's name and change the formulations and dose and dosages. Also, we have the right to refill and extend prescription for chronic conditions like hypertension, diabetes, etc. too. Also, we have the rights to initiate emergency supply for medications. So those are some certain expanded scope of pharmacists, which is really helping patients because it's a long wait time in the ERs and hospitals here. So pharmacists kind of bridging it like with their expanded scope of practice.
Thank you so much. So is there anything like you want to add?
Yeah, like as we all know that in Canada, the pharmacists, they have got the prescribing rights. So, and for a few certain things, like as Shama has mentioned, for certain conditions, the pharmacist, like if it is any skin disorder, as well as for any other conditions, whatever Shama has mentioned. So for certain things, the pharmacist in Canada, they have the rights to prescribe the medications. But as I spoke to Shama regarding this thing even before, and I came to know from Shama that all the pharmacists are not allowed to prescribe. Only the consultant pharmacists are allowed to prescribe in Canada. So all the pharmacists, they are not allowed to do that.
Yeah, we have to go through the provincial body and apply for further certification and courses. So once I cleared my exam and got license, I took the provincial courses and accreditation programs. So then I'll go through all the training, then apply for the prescribing rights. So they will approve it and then I can prescribe it. So it's an additional process to get prescribing. Yeah.
Yeah, thank you. And how employers will sponsor a pharmacist in Canada?
That's for me. Okay, so usually the employers here are sponsor pharmacists through closed work permits like LMIA. But as I said, I don't have much knowledge in it, like because I came here with a visa, like so they didn't have to sponsor my visa. But there are some programs that is focusing on healthcare professionals more than like other occupations. So candidates can apply through it, and if employers, if they are like short staffed, they can maybe sponsor pharmacists under closed work permit programs like LMIA.
Apart from this visa things and all, like, is it tough to find an employer during internship, Shama? Like after clearing KAPS exam and coming to Canada, is it very difficult to find an internship?
Yeah,
Shama?
after clearing the PBC and
Sorry, I'm so sorry. Sorry. After clearing the PBC.
So once you clear your PEBC exams, it open a lot of opportunities for you. So that certification process is a bit overwhelming and challenging. But internships in some provinces, it's hard to find internship because there is a queue for it. Like you are in line to get registered for the internship. But there are other provinces where you can get registered as interns easily. It won't be hard as clearing the PEBC exam anyways, finding an intern position.
Yeah. So I can add few things that in Canada, the main challenge is clearing the exam. So because there are only few candidates who can clear this PEBC examination, and most of the candidates, like I can say that more than 60 to 70% of the candidates who appear for the PEBC examination, they fail in their first attempt or so on. So that's why there will be only few candidates who have already got this PEBC certificate, who have cleared all their examinations. So the competition will be very less in Canada. So like it won't be much challenging. Like when once after getting this exams is done, then it becomes much easier to find the employment in Canada. But the main challenge is to clear the exams for the PEBC.
Exactly. So once you clear the national exam, then you will have more opportunities. Like it won't be really hard.
Okay, we have got a question during live, like how do the licensure requirements differ across Canadian provinces for pharmacists? Like as we have already discussed about provinces, he's asking for the requirements.
So PEBC is constant for everybody. Like so that you have to clear PEBC exams. That's for all the international and Canadian graduates. It's a bit different for Canadian graduates, but still they have to go through the PEBC licensing process. So once you clear all those steps, then you are approaching a province saying that you are interested in practicing in that particular province. So every province will have their own law examination. Depending on the province, either it can be computer based or written exam and open book exam. It differs, but everybody will have a law exam, so that will give you an insight to the jurisprudence and law structure in that particular province. So what are they trying to implement in pharmacy practice? What are the laws that govern the practice of pharmacy in that particular province? That will be different from each province, but you have to go through jurisprudence and law exam in each province. Plus the internship hours. Internship hours will be different for each province. So, but you will have a jurisprudence examination and internship in every province, but it will be differing from each province, the hours and everything, and the pattern of exam. And also some province, you have to do the bridging program as we mentioned. So that can be also different.
Yeah.
Yes.
And coming to like, I would like to ask a general question. Like, if for CAPS, if we take 3 months of coaching, it's suffice actually. And after taking examination, PT exam, English test, and after giving EOI, for receiving invitation, it will take around 6 months to 1 year. And then after applying for visa and getting visa after registration, these all things will be finished in approximate of 1 to 2 years. Like how
Yeah.
long it will take for a PEBC qualified candidate to get into Canada after all these things? Like how long it will take for a candidate, overseas candidate?
So for PEBC, like the pathway is completely different. Like I can say that
Yes.
the candidates, they can launch their visa at first itself. Okay, so they can they can launch the visa and they can also start preparing for these examinations. So when once they clear the exams, once they clear the exam, but again here for CAPS, we can say that, okay, so in case if a candidate, if they can sit and prepare for the CAPS examination, so they can clear it like in 3 months. And after clearing this CAPS, then the next step will be they will get registered with the APRA, and they need to do the internship. And during internship, there will be 2 more exams. Okay? So even if they won't clear the exam in the first attempt, definitely they will clear it in the second attempt if they have a proper guidance and so on. Okay? But when it comes to the PEBC, like because based on the previous past percentage, okay. So for PEBC, like it completely depends on the candidate's efforts, how much the candidates they put on to towards preparing for the examination. Okay. So in case if they can clear all these exams in their first attempt, like how Shama she did. So she cleared all the exams in their first attempt. So if they clear the exams in the first attempt, then the only step that will be left is just to finish the intern hours. Okay? So just to go and finish that intern hours. And again, it depends on the province. So in which province that you need to do the internship. So depending on the province, there are certain provinces, as Shama has clearly mentioned. So there are certain provinces, their requirement is internship for 12 months. Then there are certain provinces where the internship requirement is only 6 months or 3 months. So it depends on which province that you select. So it completely depends. Like we can't say that there is a particular time frame here. So the time frame, we can design the time frame in case if they clear the exam in the first attempt, all the 3 exams in the first attempt, then we can say that, okay, so if you have cleared all these exams in the first attempt, then you can become a pharmacist in Canada, like in 1.5 years or in 2 years. Okay, so if you clear all the exams in the first attempt and you do the internship, then you will become a pharmacist there within 2 years. So, but we can't give a particular time frame.
No.
Yeah.
It depends on if you're appearing only one exam in a year and another exam in the next year and the next exam in next year, it takes 3 years to clear one exam.
Yes. Yeah, just to clear the exams.
And depends on the province and the licensing, the internship hours, then again it varies. Yeah, but I would say like if you clear everything in the first attempt and then you are just doing internship hours, it will be around 1 to 2 years.
Yeah.
Yeah.
During this session, I came to I understood like PEBC is something which is very tough compared to all the pharmacy boards, which is time taking, and financially it is it is bit higher price. And
So
the
I can say
candidate
that no, sorry, Neha. I can say that financially it is not higher. Okay, so it is not higher because we clearly mentioned, as Shama clearly mentioned here, that it becomes higher only when the candidate they fail the exam. Okay, so when the candidate, if they fail the exam in their attempt, then it becomes much higher. But if the candidate prepares with a full sort of dedication, okay, and if they have the proper guidance and if they clear the exam in their first attempt, okay, then it is not at all a financial issue with PEBC. And also Shama has clearly mentioned, in Canada, the employers, they are ready to reimburse that fees, that whatever that we are paying for that exams. Okay, so at the end, like when you clear this exam and if you get this PEBC certificate, when you get registered in any one of the provinces, then the employers, they are going to reimburse all your fees, that whatever the amount that you have spent. So it means that when it is compared with the CAPS, Okay, so in KAPS you are spending the amount, but you are not getting this amount, that whatever the amount that you spend.
Yeah,
you
a
won't get-
reimbursement.
Yeah,
Like
there
we
is no
can.
reimbursement option. But in Canada, so there is a reimbursement option is there, provided that the candidate need to clear the exams. So, so I can say that, yeah, financially it is not be a big issue. In case if you are well prepared, then you need not to prepare, then you need not to go with the bridging courses, and you need not to spend that extra amount.
Yeah, same money. So I've like as you mentioned, like in Australia, we have to do 1,500 internship hours. Do we get paid
Yes.
for that?
Yes.
Sorry, Shama, 1,500 intern hours.
Yeah, do we get paid for it?
Yeah, it is paid. It's paid
Oh, okay.
hours. So
No.
the pay rate is right now, the pay rate is $27 per hour.
Mhm.
Yeah, so it is a paid internship for
Okay.
1,575 hours.
And do we require any prior experience while sitting for PEBC examination? Like pharmacy experience is all needed. Do we need any experience?
So when we prepare for PEBC, we don't really need any prior experience.
Okay.
No, but sometimes like the province where I'm practicing, you can register and practice as an intern after clearing your evaluating exam and language proficiency. Not all province will have that option. Some of the province you have to clear all the PEBC exams to start your internship. But I was lucky, like I can start after clearing my evaluating exam. So my internship with my companies, like the pharmacies, really helped me to clear my qualification. Like it was an asset, like you know what is going on. So you are like the things we do in pharmacy that gets stick into our brain. So it made me a little bit easy to prepare for the qualifying exams. But it doesn't matter like you have experience or not, like you can appear for PPC.
And what is the eligibility requirement for a candidate to sit for PEBC examination? Since it is a basic question, if you can like explain it briefly, it would be very clear for the candidates.
So if you have a 4-year undergraduate pharmacy degree and you clear the document evaluation, you will be eligible for the document evaluation through PEBC. And once you clear the document evaluation, you can apply for your PEBC exam. That is only eligibility criteria.
Yeah. Thank you. Thank you,
So
Shama.
Canada, yeah. So Canada, Australia, New Zealand, UK. So these are the countries which accept the 4 years of bachelor degree. So it means that candidates, those whoever have done the 4 years of bachelor's in pharmacy, then they are eligible to become a pharmacist. They are eligible to write for the pharmacist licensing examination.
Yeah.
Only in case of if they are planning to move to US or to Ireland. So in those countries they need the Form D, but rest of all the other these countries they need only the 4 years of bachelor degree.
Okay, yeah. So sometimes people come here and take a position like a pharmacy assistant. I don't know if it exists in Australia, but here there is something like a pharmacy assistant position, which is not licensed. So sometimes people work as a pharmacy assistant while they do PBC exams so that they can make some money. And also they'll get an experience in the community pharmacy settings. So that's also like a good way, like to approach PBC. Also, they are getting some practical experience in the pharmacy, plus you are prepared for the PBC.
Exactly. So the same thing here in Australia as well. So the candidates, they can work as a pharmacy assistant, or they can also become a pharmacy technician. So they need, in order to become a pharmacy technician, they need to do, there is a course that is the S2, S3 course. So when once the candidates, they finish that S2, S3 course, then they become the pharmacy technician. So like many candidates, like those who are getting trained at Elite Expertise, so now they are working as a pharmacy technicians, and now they want to become a fully licensed pharmacist. But to become a fully licensed pharmacist, again, they need to go through all the licensing pathway. So they need to clear all the exams.
Yes, yes. But if you're looking for some Canadian experience, you can work as an assistant, and like it doesn't you don't have licensed process. So once you clear PBC, you have the experience of pharmacy assistants. That will be an add-on on your resume.
Yeah.
But as like Arif was mentioning, if you want to work as a technician, then again it's a different licensing process. So I wouldn't recommend if you're doing for technician, then why don't you just do for pharmacist?
Exactly, yeah. So
Yeah.
they can better go for the pharmacist rather than
Yeah. Yeah.
spending the time into become a technician.
Yes.
And out of my curiosity, how about the temperatures? Like me being an Indian, we have summer, spring, etc. We have 4 seasons, right? Like,
Yeah.
can Indian candidate adjust to this candidate? Because I think it is in minus degrees for almost 8 long months in a year. Is it can we adjust to those temperatures, Shama?
So winters are extreme and longer in Canada.
Mhm.
It can be a little bit depressing, but you'll get used to it because there are too many activities in winter. We don't have extreme winter in India, so we don't know about it.
Yeah.
We don't know about it. But these people are used to winter, so they have a lot of activities and everything so that to cope up with winter. And everything will be heated here,
Yeah.
winter outside, but all the apartments and all your vehicles and your workstations, everything will be like temperature control, so you can set up the temperature you want.
Okay.
Outside will be snowing and it will get dark soon.
Mm.
But to cope up with that weather, there are like too many winter activities, so it won't be a big problem. And if you're working if you're finding a job in a more remote area where the winters are more extreme, you'll be paid more.
Oh,
That's the advantage here.
yes,
Yeah, exactly. So even I can say that here in Australia, like in Tasmania state, all
Yeah.
others it will be much cool. We will have like a cold winters up over there. So this year the temperature was minus 13 in few places in Tasmania. So it depends, like not only in Canada, but even in Australia. So there are certain places where the temperature will drop like in minus. So even Melbourne temperature always it will be cold in Melbourne. Like early in the morning, it will be like minus early in the morning. And the maximum temperature in the winter during the daytime, it will reach only 8 or 9 degrees Celsius. So yeah, so these are the few things like the temperature issues. These are quite common. So not
Yeah.
only in Canada, but even in other places as well.
Yeah, sometimes candidates, what they do is like some provinces like Yukon or Labrador, they have extreme winters, but they pay like high rate, like what you
Exactly.
make in a year, that you can make in less than 6 months there. Right?
Yes, it's 6 months.
Province will pay additional money to stay there and work because it's
Yeah.
hard for them to find a resource. Sometimes
Exactly.
can take short-term contracts in such provinces, and they will make more money and will have a we are all working for financial
yes,
independent.
Exactly.
that's
Like at the end of the
So,
day, what we
yeah,
especially for those who are,
that's true.
for
yeah,
all
Like,
the
we get
overseas
valued for
candidates.
what we are doing.
Yeah.
That's it.
yes.
Yeah.
So they will go there for like, especially when people, fresh graduates who are coming out of college and they have like education loan and stuff, they will go to some province and make money and pay towards their loan. So they do that too. So we can make advantage of all this extreme conditions. Like,
Yeah.
that's how we cope up with it.
Yeah.
Like, thank you, Shama. And we
So
have a
I can say
question.
that especially for those who are from our Asian backgrounds,
Yeah.
okay, from India or any other countries. So at the end of the day, what we do is we'll check, okay, because we are taking efforts to leave our country and to go and work in some other place, some other countries. So at the end of the day, what we do is we will check that, okay, so if I go there, what I will get, how much will I get, how much will I,
Yes,
and how much will I save in my bank account.
definitely, sir.
These are the
Definitely.
only things that we calculate. So that's the main reason why we are preparing for these exams and why we are leaving our countries, why we are going up over there and working in Australia, Canada, US, and so on. So
Yeah.
we need some sort of benefits at the end. So
Yeah. So for
The
most
bigger,
immigrants,
sorry, Shama, continue.
so most of the immigrants, we are leaving our home country, our parents and all our roots there and coming here. So there is nothing wrong in following money and like having a financial independence, because that's the major reason everybody is migrating.
exactly.
Like, there is a bigger picture once a candidate clears PEBC for sure, with no doubt, actually. And we have a question from Deepak. Is it mandatory to take personal professional liability insurance after clearing PBC to practice in Alberta province as pharmacist?
Okay, so Deepak, for anybody who work as a registered or licensed, whether it's an intern, a technician, or a pharmacist, you need to have a liability insurance. So that is covering you, like that's defending you. Like so, when I worked as an intern, I had a liability insurance coverage through the Pharmacists Association. So that when you start working as a pharmacist, as I was saying, most of the employees, they cover your liability insurance fee. So they will pay for the liability insurance. You don't have to pay for anything. So your employer will buy a liability insurance for you. So any licensed profession here need a liability insurance.
Yeah, even in Australia, without the liability insurance, we can't practice it. Okay.
Now,
Because
even if it expires
anything,
for one day.
yeah,
No.
yeah, because practicing without the liability insurance is nothing but it's just a dangerous task. Okay?
Yeah.
So
Yeah.
anything might happen. So it is mandatory in all the countries. Okay. So not only in Canada, but in all the countries. So we must have this liability insurance. But the advantage in Canada, as Shama clearly mentioned, that the employers, they are going to pay for that. But in Australia, we need to pay
Yeah.
out of pocket.
That's a very good thing. They will keep in touch with
Yeah.
you. Like your liability insurance is going to expire in 1 month. Renew it. We are going to pay towards it. Like they are
Okay.
always upbeat about all those stuff, because once it expires or someone like practice without a liability insurance, it can cause a lot of problems. Like
Exactly. Yeah.
they
Yeah.
can even suspend your license. Like
Definitely.
Yeah.
So that's going to happen. Like we must every candidate, like even interns, while doing the internship as well, so they must have the liability insurance. So without the liability insurance, they can't practice.
And PBC qualified candidate, after taking the exam, are they considered as a licensed pharmacist straight away? The question by SS actually.
Sorry.
So you are clearing the exam, then you are getting registered as a pharmacist through the province. The province is giving you that title. So you are a registered pharmacist in the province. So if you are registering in Ontario, you are a registered pharmacist of Ontario. But PBC qualifies to PBC is qualifying you to be a registered pharmacist. But province is the one who give you that license number and everything.
Okay.
So it means that at first they need to clear this PEBC exam, and this PEBC exam is the common exam for all the provinces. So we can say that it is the federal one. Okay. So, and once after clearing this PEBC exam, then when if the candidate has decided to practice in any one of the province, let's say for instance, as in British Columbia or any province, then they need to apply for registration in that particular province. Okay?
Yeah.
And they will get the license from that particular province. It means that they can practice in that province.
Yeah.
Right? There is a chance that it doesn't mean that once the candidate is registered in one particular province, they cannot practice in other provinces. They can still practice, but they need to get registered in the other provinces as well, in case if they want to move to other provinces.
Yeah. So once you clear the PBC, you are qualified to practice as a pharmacist in any province. So, and that once you clear the PEBC, it's just a matter of time. You choose a province, you just clear the law exam and do internship, and you get registered. PEBC cannot afford to have all the pharmacist licensing process through them, because each province should have a list of the pharmacists. So even if you like, once you even if a patient has a query, like if they are doubtful, is this person a licensed person? So they will go to the provincial regulatory body and see, like, so the province will say, yeah, this person is licensed under this licensing number and is practicing as a pharmacist.
Yeah.
So everything is transparent in Canada, right? Like coming to health sector.
Yeah.
And we have Lily here, Shama, who has some questions. And I would like to ask Lily to take up the questions. Lily, please.
Yeah, actually, I have a question. Like, actually, Canada was a dream country for me. Actually, Shama knows that.
Yes.
And my question is, like if I clear the entire exam at one go, how long it will take to be a registered pharmacist in Canada for me? Like if I'm clearing the entire exam at one go, so how much time it will take for me to get be a registered pharmacist in Canada?
So once you clear all your exams, PBC exams in one go, like in a one attempt, then you will choose a province. So what if your internship is only 2 to 3 months, then you can get registered in 3 months. But as I said, like some provinces will have longer internship hours. My internship took like 8 to 9 months. So then you have to invest more time in internship. So as I mentioned, like once you clear PEBC exam, it's like a matter of time, like how many hours you have to do internship with the province, and you have to clear the law exams. Still varies from one province to another.
So the internship hours also varies according to the province?
Yes.
Okay. Yeah, thank you.
So there are certain provinces, like as Shama has mentioned, there are certain provinces where the intern hours that like they need to do the internship for around 10 to 12 months. And there are certain provinces where they can do the internship only for their internship requirement is only for 6 months. And on certain provinces, the internship requirement is only for 3 months. So it depends on province, which province the candidates they need to practice, they want to practice. So they need to, so they need to go through that province and they need to do the internship hours requirement to be fulfilled for that province.
So here in Canada, province have very good, strong authority for pharmacy practice. So they are the one who always set rules and guidelines and how many hours a pharmacist should do an internship hours and what language proficiency. So they keep upgrading it and keep changing it. So PEBC is just a national test where you get qualified to practice as a pharmacist in Canada. But your practice as a pharmacist in Canada is regulated by a province.
Okay, so if I am a registered pharmacist and I did my internship, everything in Ontario. So after a few years, I'm planning to move to British Columbia. So should I do the internship again?
No, most of the province don't let you do the internship. If you are a practice, so in Canada, once you register as a pharmacist, either you can practice as a pharmacist in patient care or a non-patient care. So patient care is where you practice with community pharmacies, hospitals, long-term care homes. But non-practicing is when you go for academics and in pharmaceutical industries and stuff like that. So once you're a practicing pharmacist in patient care, it will be easy for you to transfer your license to any provinces because you are already doing something for the patient care, right? So you're working for patients. So you will only have to take a law exam. Okay. You don't have to repeat your internship hours. But if you were a practicing pharmacist in non-patient care and you have to switch to patient care, then you might have to undergo more internship hours or something like that. Otherwise, it's easy for you to transfer between provinces. And people do that all the time. People act as like a travel pharmacist where they will do a 6-month contract in Ontario, then they will go to British Columbia for 6 months. You can still keep different license for different provinces. I can have a pharmacist license from Ontario and I can have a pharmacist license from British Columbia too. So, and I can act as a travel pharmacist. I can travel like between provinces.
Neha, you're mute.
I'm sorry. Like coming to the next question, like are there any negative marking in the evaluating exam, Shama?
No, there is no negative marking in evaluating exam. No, you'll get either 1 or 0.
2. That's fine.
But when you go for qualifying exams, there are like questions like 50. If you have 200 questions, 150 questions will be scored and 50 questions will be unscored. And you don't know which ones are unscored. You have to answer everything. But they will take 50 questions out of it. Like that will not be scored towards your passing criteria. They do that. They used to do that for evaluating exam, but now they have bring it down from 200 to 150. They took it out, I guess.
Okay.
But no negative marking, which is good.
Yeah.
So overall, we can write 3 times, right? PEBC. So is
Yes.
it like one exam 3 times or all the exams 3 times?
No, each exam you'll get 3 attempts.
Okay.
Yeah.
Okay, then I think I have I've asked all the questions from what I've written here and from the candidates as well who have attended the webinar. Is there something else, Arif sir? Do you have any other questions to ask Shama?
No, the only thing is that the candidates, they were asking that how difficult it is to find the internship in Canada once after clearing this PEBC examination. And as Shama has clearly mentioned about it, so it is not that too difficult. When once the candidates, they have this PEBC exam pathway is done. So once all the examinations are done, then the candidates, they can easily find the internship in Canada. So it is not that too difficult. So yeah, so
Arif sir, when are we going to start this PEBC coaching classes and when is our orientation day? The candidates wants to do.
Yeah, at Elite Expertise, we are going to start our PEBC training course on 20th of July. So that is coming next week on 20th of July. And the orientation date is on 20th of July. So on 20th of July, we have the orientation program. And the following week, we'll start taking the classes for the PEBC.
Adding to Arif sir, our team is available for 24/7. Candidates who wish to enroll with us, we are happy to assist you and we'll be available for you anytime. You can just contact us anytime. We'll get back to you for sure. And I would like to ask the final question to Shama. Shama, can you share your personal experience before writing PEBC exam, while you are writing PEBC exam, and after your PEBC exam? 3 phases of your life during the PEBC thing.
So I worked as a clinical pharmacist in Mumbai. That's when we decided to move to United States. That was with regards to my husband's job. So when we moved to United States, I got certified as a pharmacy technician there. And then we were planning to appear for the NAPLEX, the pharmacist exam in United States. Then that's when my husband's company, they were deciding to move him to Canada. So we were weighing the pros and cons of both countries. And then finally we thought we will move to Canada because it has more immigrant friendly rules. So then what happened is while working as a pharmacy technician in the United States, I started preparing towards my PEBC journey. So I gave my evaluating exam while I was working as a pharmacy technician in the United States. So as I said, due to the pandemic, they had the option to write exam from United States. So I didn't have to travel from Canada. So I wrote my evaluating exam in United States. Then we decided to move to Canada. And I cleared my IELTS while I was there. And then when I moved to Canada, I could start my internship with Canada, with the company here, because I cleared my evaluating exam and my language proficiency. This province, as I mentioned, had the option to work as an intern. So I moved in October 2022, and November 2022, within a month, I got an intern position. So it was not that hard. So when I got my intern position, I applied for my qualifying and exams, part 1 and part 2 together. I paid for both together. So I was doing my internship hours part-time, and then I was studying for the exam, both the exams together. It was very, very intense for me because I was working and I was appearing for both the exams together. It was overwhelming, but everything together helped me to clear all my exams in the first attempt. So once I cleared my exams, I had a little more internship hours pending on my. So I cleared my exams, then I cleared my internship hours. So once board approved my internship hours, I went and wrote my jurisprudence law exam. So once I cleared jurisprudence law exam, the same employer who employed me as an intern, I signed a contract with them to work as a pharmacist. So once I started working as a pharmacist, I took a position like a relief position. So they have too many too many branches here, too many stores here. So whichever store has short staff, I would go there and work for them. So that gave me a lot of experience because each pharmacy setting were different. Some were long-term care, some were like more focused on opioid and de-addiction and stuff. So so I worked with between all those stores. So yeah, that's my journey.
It's interesting, Shama, and it's like as we know, like we are studying, we are doing research and all. We understood that clearing PEBC in a first attempt is something which is very great. Actually, we are happy for you and congratulations on that. And one more last question. Like, is it possible for a candidate like who has experience in Canada after clearing PEBC exam? Like, can we practice in USA too? Like, not beyond like NAPLEX or something. Is like, are there any routes like? Is it like mandatory to write NAPLEX for that also?
Yeah, so even if you are a Canadian graduate or international graduate or you're working as a pharmacist in Canada, you still have to go through the licensing procedures in United
Okay.
States. Same with United States, even if you're a practicing pharmacist in United States, you still have to go through the licensing procedures in Canada.
Okay.
There is
So,
no way you can transfer it. Like it's not a very easy transfer.
so is there any
But I think
difference?
for nursing profession, they can, but not for pharmacist.
So is there any difference between an Indian pharmacist who's migrating to USA and a Canadian pharmacist migrating to USA?
So I would say like Canadian licensing process is a bit more complicated than United States. Like that's what I feel. But again, in United States, even if you have a 4-year undergraduate pharmacy degree, you still have to go through pharmacy school to match up with the PharmD program. So that's an extra step and extra money. So Canada has an advantage. You still can appear for the exam even if you have a 4-year undergraduate degree, which is really good. Yeah.
So that's the main difference. Like in US, again, even if we are practicing here in Australia or Canada, it doesn't matter. So in case if we want to become a pharmacist in US, again, we need to go through NAPLEX pathway. And to go through NAPLEX pathway, and if we have only 4 years of bachelor degree, at first we need to do that PharmD, that is the post-bac PharmD. Then after finishing that PharmD, the 3 years of post-bac PharmD, then we are eligible to write for this NAPLEX.
They will evaluate like all our pharmacy degrees, like United States, they have a body which will evaluate our pharmacy degree and postgraduate degree and everything. They will say this many pharmacy school hours we have to write, the PharmD hours we have to do, which is expensive too, like it's not cheap.
Yeah, exactly. It is.
So, so like, what is the validity of this PEBC? Like, first exam, is there a time period that second exam should be written in this much period itself, like that?
So, document evaluation has a validity of 5 years, but the evaluation exam doesn't have any validity or timeline.
Okay.
Yeah.
So it means that once the candidates they have done their document evaluation, initial document evaluation, so they will be having the 5 years time. So within this 5 years time, they can clear all these examinations, that is evaluating exam and the qualifying examination part 1 and part 2.
So what about internship after finishing all the exams? Like how long we can like
it is valid.
Yeah, okay.
Valid, yeah. It doesn't have.
There is no time period, like I can do internship at any time after the exams?
Yeah. But again, like depending on the province, they keep changing. Like they can say like you are not practicing for this many years or something like that. They can increase our internship. It's the authority of the province.
I think that's a good thing.
Okay, and the final thing, like any takeaway message for the candidates who wish to sit for PEBC exam? Like not takeaway message, any like message you want to give to the candidates who wish to sit for PEBC exam, Shama? Like how to prepare mentally and like everything. There are many certain things to sit for KAPS examination. It's not so easy, right? Like how they need to prepare. Like
yeah. So PEBC, as I mentioned, you hear all these stories, so you know it's very challenging and overwhelming. You will feel it is so intense, but it's not like something impossible. You can all do it. If I can do it, anybody can do it. Like so, once you start preparing for towards your PEBC journey, once you start preparing for PEBC validating exam, make sure you know all the concepts clear. Like evaluating exam is like the foundation for the next exams coming up. So if you invest some time and try to understand the concepts thoroughly, you can build on it. So if there will be points where you will feel like this is not going right directions, or you'll have your own ups and downs. But once you clear all the PEBC exams, you will have a lot of job security, like because the pharmacist job market here is pretty steady. So whatever happens to other occupations, the healthcare jobs are always in in a steady state. So you won't be like jobless. You'll have lot of opportunity. As I was saying, like you can practice in any province. You can act as travel pharmacist. If you want to make more money, you can travel anywhere. Like that is giving a lot of security. So there is effort and hard work is worth it. So never give up. Keep going.
Yeah, exactly. So whatever Shama has mentioned that like yes, it is a bit challenging exam. PEBC is a challenging exam, but once if you clear the examination, then you will have a very good opportunities in Canada. So the main thing why the candidates they just be scared of appearing for this examination is because everyone they will be saying that okay, it's a long pathway, it's a very tough exam, it's difficult to clear this exam. Okay? So but it's not that so difficult. In case if we are prepared well, then everything is possible. So it completely depends on how we prepare for the for this examination. If we are prepared well, then definitely we can clear this examination. So it's not a big deal.
Yes, sir, definitely we can say that because KAPS exam, everybody told me like it was very hard, and sir and my ma'am actually made it as a piece of cake. It was very easy for me because they taught us like that. So definitely, if sir and ma'am is teaching, definitely PEBC will also be very easy.
Yes. So we are all here to help and support you. So
Yeah.
it will be possible.
Any further questions, Neha, or shall we end this session?
No, sir. Actually, everything is done. Like we have covered each and everything. Like I would like to thank Shama first for patiently answering everything from starting, like what the before the exam, during the exam, and after the exam. Everything you have said, everything so patiently. And Arif sir, we are very delighted to have you here, and your presence is like we just celebrate your presence, sir. We are very happy to be here.
Neha,
Yes, ma'am.
on lighter note, what is the time in Australia now and in Canada?
So,
Yeah.
So now in Australia, the time is 2 a.m. early in the morning. That is midnight. Midnight.
Good morning, sir.
Yeah.
It's 1:30 p.m. here. I'm a little starving. I was hungry.
It's 9:30 p.m. in India.
Oh.
So we all are in different time zones.
Yeah.
That's how Elite Expertise is running. Like we are at we are working with different time zones, and how our team, like this is how our team is like building and growing strongly.
Yeah.
And really thank you for your questions, and Ashita ma'am, Sahana, everyone in Elite Expertise. Thank you for all your efforts, and hope everything went well today. Like I would like to take that's all from my end. I would like to ask Arif sir to like convey his.
Yeah, thank you, Neha. Thank you so much. And first of all, I would like to thank all the audience who are watching this live session. Okay. And like your questions, like you have raised a lot of questions today, and we like we gave our answers, but still, if you have any further questions, please don't hesitate. You can just keep on texting us. Okay? So please visit our website to Elite Expertise, www.eliteexpertise. Okay, so you can visit our website, and also we have our WhatsApp numbers up over there, so you can just chat to our friendly team members. So they will let you know what are the questions that you have. And yeah, thanks for everyone for attending this live session, and special thanks to Shama, okay, so for spending her time with us, and by being for being a part of Elite Expertise team.
Thank you everybody. It was good to have you all.
Yeah. So thank you so much, guys, and please remember that our PEBC classes are going to start on 20th of July. So that is from next week. On 20th of July, we have the orientation session. And also, like I request everyone to attend to watch the demo lectures, so that you will come to know that how quality of education that we provide at Elite Expertise. Okay. So if you have any further questions, please contact us on WhatsApp. And also, please don't forget to subscribe our YouTube channel. So we'll provide a lot of information regarding the PEBC and regarding the updates for PEBC on our Elite Expertise YouTube channel. So thank you so much. Thanks for watching this live webinar today.
Bye.
Bye. Thank you. Thank you, everyone. Bye.